Sam, have we done a sound check just to make sure that everybody's sound is, everyone is audible?
Hi, Joanne. Can you hear me okay?
Not really, not a green background.
Sorry?
Yes, we can.
Hi, good morning.
We can hear you.
But I think the image is a bit funny.
Yes, I know. I was told, are you behind, do you have a plain background behind you?
Yes.
It's a plain background.
Oh, okay. Apologies for, I should have done a tech. Oh, that's not even much better. Is there anything to be done, or do I?
Are you in front of a light source?
Yes.
So there's a light in front of you?
Yeah. Do I need to?
Okay, Sam, device.
Does that help? No, it doesn't.
Okay, we're waiting for the other speakers to join.
I think I've spoken and I'm clear.
Temitayo, your lighting is weird. You're looking strange. What's happening with Temitayo's lighting? Some setting that you may have selected. You're muted, so we can't hear you.
Should I try and dial back in?
This is a dial-in problem. It's looking like a setting on your video.
Right. I'm using this. Any advice from the tech folks? No. Is that better?
Yes, much better.
Around time.
Much better.
Oof. Is David on?
It seems not. It seems that it's just Mrs. Ajayi we have here. Hello, Mrs. Ajayi. Thank you for joining early.
Thank you. I thought we were starting at 10.
Dikachi, are we starting at 10?
Yes, we're starting right away. He's none other than Temitayo Erogogo. Temitayo Erogogo has over 20 years of combined private sector and international development experience. Temitayo works as the advocacy lead for MSD for Mothers and as the strategic lead for multilateral organizations engagement within the corporate and social responsibility team. His responsibilities has spanned across supporting health equity goals across franchises by demonstrating value to internal and external stakeholders and extending access to solutions that address unmet health needs in a sustainable manner. Building on best practices from leading global advocacy for MSD for Mothers initiative, his efforts have forged new collaborations with organizations that include UNFPA, the World Health Organization, USAID, Gates Foundation, Asia Development Banks, World Economic Forum, and other institutions to strengthen health systems and address unmet health needs. In line with his passion for addressing health equity, Temitayo worked with HIV/AIDS patient organizations, governments, and other stakeholders in Europe, North America, and Africa to drive the implementation of policies and practices that improve treatment and access to quality and affordable care. To give us an opening remark on today's webinar, please welcome Temitayo Erogogo. Thank you for joining us.
Thanks very much for that introduction. And it's a real pleasure to be here and on behalf of MSD for Mothers. And I think this conversation comes at a really important time for our country, but also in terms of the global discussion around providing access to care and also specifically the issue around maternal health, as Vivian quite well summarized at the beginning of our session. MSD for Mothers is MSD's philanthropic initiative to help reduce maternal mortality across the globe. It's a commitment we've made over 12 years or 13 years ago now. We're very proud to be playing a role in trying to think of different ways in which we can help to reduce maternal mortality, not least in high burden countries such as Nigeria, which has the unfortunate status of having one of the highest maternal mortality rates in the world. In doing so, one of the things that we very quickly honed in on when we started the initiative was actually how can we make the biggest difference given the relatively limited resources that we have. And what became very obvious very quickly was that if you follow the way in which care is provided in a lot of settings in LMICs, whether it's in Nigeria or in other high burden settings such as India, a lot of care is delivered through private providers. So that was very much at the early stage of our initiative, an important focus to see how we can make a difference there, not least because a lot of attention is not put on the quality of care that has been delivered there and the impact potentially that has on outcomes. And I think that is a critical area we need to focus on. The other point I wanted to make as part of my introduction is also that quality actually really matters, and we are actually losing more people due to the poor quality than lack of access to care. And it's important to keep that in mind when we have this conversation. It's not so much about just giving access to people, but actually making sure that they can actually receive the right quality of care when they actually have engaged the health system. And related to that, it takes a whole health system to actually, a quality-focused health system to actually deliver a better outcome. It is not just about having a clinic. It takes a lot for that clinic in itself to function, but behind all that is a health infrastructure that needs to be delivered, that needs to be developed and needs to deliver support to the front line. And in relation to that, that is where I think the private sector conversation needs to be better understood. Because as Vivian mentioned earlier on, this is not just about the point of access, but actually the systems that are required, including things like diagnostics. How do we ensure that basically we can have the right kind of infrastructure that can do that on a routine manner, and we can be assured of the quality that's being delivered, so trusting in the results that we get. Issues around transportation, electricity, water and sanitation have major impact on healthcare delivery. And that is not just a huge undertaking. It's a huge undertaking that requires a huge amount of resources, which in reality, especially in a country like ours, as you've seen from the various health policies or economic policies that have been brought on by the new administration, is a huge challenge. It's a huge potential financial burden on the country, or investment on the country, actually, I should say, rather than a burden. But nonetheless, something that has to be paid for. And given that cost, an opportunity exists to be able to lean into the private sector, to be able to actually help offset some of those costs by being able to draw down capital from other sources that can provide those services. The critical difference, though, or the critical gap that we've seen in a lot of settings is that because of the lack of structures and policies to be able to integrate private sector into the health system in a more strategic manner, we are not being able to allow them to draw down that capital for investment in things like diagnostics, infrastructure, etc. And this is a missed opportunity that I know many people are working on, including some of our panelists, to be able to address. And you hear from David Clark at WHO and the efforts that the WHO is doing writ large to actually trying to help to change that dynamic, because without it, not just Nigeria, but other countries, we really struggle to actually meet our goals from a universal health coverage perspective, but also specifically, as we've just been discussing, from a maternal health perspective, where mothers are often left behind in healthcare delivery. So I'll stop there, and we'll just want to say thank you very much for the opportunity to collaborate with you, particularly on this conversation, because we really believe this is an important opportunity for us to be able to make a difference in improving broad access to care and the impact or improving health outcomes as well. Thank you.
Thank you so much, Temitayo. It's always refreshing to listen to you on when you expound the various ways that the private sector can integrate to build resilient health systems. Thank you. Next on the agenda, I would welcome David Clark for his talk on engaging the private sector. David Clark's career has focused on human rights and health systems strengthening. He has worked as a senior official in government, a partner in consulting firm, and as a volunteer board member and chair. He has worked as a manager responsible for work and professional development of a team of 14 public health professionals and committed to rebalancing opportunities for women professionals. He leads research and the development of advice and guidance for World Health Organization member states and the units. And the units work on providing technical assistance to WHO member states in collaboration with colleagues from regional offices and country offices. David currently works as the WHO headquartered in Geneva as the acting head of the Health Systems Governance Unit and as the Global Technical Lead on Health Systems Governance. You're welcome to the webinar this morning. Thank you for joining in.
Thank you very much for that very kind introduction. So, colleagues, I'm going to leave my camera off because I'm in Washington, D.C. today, and it's 5 a.m. So, so apologies for this. But thank you for the great opportunity to talk about the Country Connector, and thank you very much for Teo's kind introduction. So, as Teo said, WHO is trying to do a lot more to look at how we can better integrate the private sector into many different health system responses. When it comes to maternal and child health, obviously there's a big agenda around quality, but also about access to health services. And I think during the COVID pandemic, we really saw how in some countries, the private sector was well utilized to make sure that women had access to much needed services, but in other cases it wasn't. So we're very much wanting to change this and to do more to support countries to better integrate both the public and the private sector into the efforts to improve health services for all. So I'll just start my presentation. Sorry, here we go. Can I just check that you can see my screen, please?
Yes, we can.
Thank you very much for that. So I'll just very briefly talk about the Country Connector. So the Country Connector was actually set up as a response to COVID-19. It was set up to support countries to better work with the private sector as part of the response. As Vivian said, it was set up on this idea that we needed an all hands on deck approach to working in relation to the response. And it was set up to try and help countries not only have access to vaccines and the important public health measures that were required for the response, but also really critically to maintain essential health services. And I think one of the big messages that we learned from the COVID situation was how much the COVID emergency negatively impacted on essential health services. So what we're trying to do with the Country Connector was to address that. But I think what's really important now is that we all know very well that we are way off target because of COVID when it comes to the SDG targets. And I was lucky enough to talk to Vivian and Teo in a panel in Geneva during World Health Assembly Week. And what was very evident was that in the post-COVID situation, when we're way off track on the SDG goals and targets, and where we're facing constrained resources because of the COVID emergency, that we really do need to be a lot more efficient when it comes to health services and health systems. And that means, and efficiency means, making sure that everybody, public and private, can be involved in the operation of those, in the building of resilient health systems. So, I mean, I'm not going to go through all of this, but it's very clear. If you look at the SDG monitoring framework, we're way off track for the SDG goals and targets. So what's really clear to us, and has been clear since the start of the SDG process, is that we need local action on this. It's not just a matter of matters done in Geneva. It's something that needs to be done country by country, and we need to transform the way that policies, budgets, and institutions and regulatory frameworks are aligned to mobilize all actors, including the private sector, to accelerate progress towards the SDGs. And we absolutely recognize the importance of the role in private sector in health as a critical partner in ensuring access, in terms of introducing innovation, efficiency, and quality, and as a critical collaborator in relation to health services. And we've done various studies just to show what a big part of the health system the private sector is. Now, I apologize for repeating these figures because I'm sure many people on this call know this, but I think it's very important for me every time I speak about this to really underline just how big the private sector is when it comes to health services and what a big contribution it makes. Yet, efforts to better integrate the private sector in many countries are still not good enough. So what we want to do, I'll just flash through some of these slides. So we really want to make sure that we can do more to deal with some of the problems that are created because the private sector is not well integrated into the health system. We continue to see parallel delivery systems. We continue to see problems with data. We see continued problems with duplication of efforts, and we continue to see, I think, systems which aren't resilient. I think without working with local private sector actors, we are going to continue to encourage donor dependency rather than look at how countries can build their domestic capacity to work to produce much needed health services for their entire population, and especially for women and children. So really, there's this huge imperative to move from primarily a public sector focused environment towards what we describe as a joint partnership environment to support efficient and sustainable development and to support efficient and sustainable health services. Sorry. So the missing piece in all of this is the work that, from a WHO perspective at least, is building the capacity to govern. So we note that what the big problem here seems to be that to create this needed ecosystem for collaboration and alignment to govern the whole health system requires us to make more investments to support ministries of health and governments to actually govern the system in a way which reflects the reality of the system. So not just manage the services that they're responsible for, but to actually work with all the different actors in the system. So this is why we're really much focused on creating this enabling ecosystem for sectoral partnerships. And this is why I'll just go through this, why we set up the Country Connector. So originally, as I said, the Country Connector was set up to help countries with the COVID emergency, but now it's shifting. We are moving to a place where the Country Connector is being used to work on this agenda I've just been speaking about. And one of the important aspects of the Country Connector is, and always has been, an emphasis on how we can support countries to improve maternal and child health. And within the connector, we have a number of different imperatives. So just on this slide, we have a very quick overview of the conceptual framework that we're using for our private sector work at WHO. But maybe I could just turn to the Country Connector itself. So how we operate in practice in the Country Connector is, excuse me, we have a number of different offerings that we are providing. So we're providing technical advice. So we are very conscious that countries, in many cases, want to work, may want to work with the private sector, but don't know how. So we're trying to do that through increasing availability of key tools that countries need to better work with the private sector, and critically, and this isn't an invitation as much as anything else, we're trying to do more to highlight areas of good practice, so that many of these areas might not necessarily be well written up, they might not be in the peer-reviewed literature, but we think it's really important that we identify, write up, and learn from really great examples of practice in this area. And we're really keen to hear from anybody who wants to tell us about what they're doing, so we can share that information with our broader audience. We're also very focused on building the capacity of governments, but also private actors, to work together. So we have an online course on this topic, and we're about to update it. At the moment, the course is very much focused on COVID-19, and we are now going to shift and move to a course which is more broadly focused, and it will definitely include material about the specific issues about maternal and child health. And we're also working with partners to share experiences. So we have a plan for a private sector engagement forum where we'll bring together the private sector and government to talk about and build concrete areas of collaboration. We also have a number of technical working groups, including a technical working group on maternal and child health, where we bring together countries and experts and UN partners to talk about the much needed information and how we deal with the difficulties associated with some of the areas that we're talking about on the webinar today. So in terms of our overall ambition, we really want to improve health services to achieve universal health coverage, to improve maternal and child health, but also to improve health security. And really we want to do that by harnessing the collective national expertise and resources of the public and the private sectors. We're very much interested in we're now moving into a phase where we want to be much more action focused. We've done a lot of work to set the scene, as it were, with WHO's strategic work in this area, but now the Country Connector is really intended to provide a basis for some action at country level. So I think I will stop there. If you haven't already had a look at the Country Connector, please do so. And I'm very happy to answer any questions, but thank you very much for the opportunity to talk about the Country Connector and about WHO's work in this area. Thank you.
Thank you, David Clark, for your insightful presentation on the Country Connect and the role you have played in private sector integration. We already have questions from our guests, our participants. Thank you for the conversation. We will move over to, okay. All right. We will take up some questions. Apologies, please. I didn't hear that.
Yes.
Okay, apologies for that glitch. Well, we have questions from our guests already, and we will move to the question and session answer right after the panel session. But before we go into the panel session, we have a question for our speaker, David Clark, who just gave a presentation on the Country Connect by WHO. So we would like to know if you have country examples that you can tailor this work to, instances of countries that you can share with us across the various health areas that this project has been implemented.
Yes. So if you please have a look at the Country Connector website, we have a number of country examples and a number of country case studies, and that's what I guess I was saying at the very end of the presentation, is that this is very important that we get more of this information. So yes, we have those. We have a series of blogs. We have a series of case studies. So please have a look at the Country Connector, and if you have any questions, please reach out. And if you want to share information, if you want to write a blog, or if you want to share information for a possible case study, please reach out. We're really keen to hear from you.
Thank you. Thank you very much. Okay. So our panelists are in the room. We have, and I'll move on to welcoming them for the next session. In the next 35 to 40 minutes, we'll be having a discussion with 3 panelists on building resilient maternal health care systems through private sector integration. The first panelist I will introduce is Dr. Pamela Ajayi. Dr. Pamela Ajayi, renowned physician and healthcare leader, and is the president of Healthcare Federation of Nigeria, chairman Bridge Fertility Clinic, founder Pathcare Laboratories, creator and host of Doctors on Air, and a collaborator at the Dawn Project, the Sikh Trust. With her primary qualifications from College of Medicine, University of Lagos, Dr. Ajayi is a British Chevening Scholar and an alumnus of both Harvard Business School and Lagos Business School. Her work over the years has focused on addressing fundamental issues in the Nigerian health sector. Dr. Ajayi is dedicated to transforming healthcare systems through public-private partnerships, driving value creation for multinational businesses, and establishing financially sustainable and thriving organizations. She is a passionate advocate for quality healthcare, and her vast expertise has influenced policies, health equity, and the improvement of healthcare systems, as well as the formation of strategic partnerships. Dr. Pamela Ajayi is a highly respected healthcare professional who has made a significant impact in the healthcare industry in Nigeria. Once again, good morning, Dr. Pamela. Thank you for joining.
Good morning. Thank you for being me on.
Dr. Ben Nkechika is also on the panel and is in the room. He is the Director and Chief Executive Officer of the Delta State Contributory Health Commission. He was the pioneer medical director of the Delta Specialist Hospital, a private hospital in Bonny Island, Rivers State, and the pioneer medical doctor at the Nigeria Liquefied Natural Gas Company Hospital for the phase 1, 2, 3, 4, and 5 construction projects in Bonny Island. Before setting up the Delta Specialist Hospital and the NLNG Hospital in Bonny Island, Dr. Ben Nkechika was a field medical officer at Schlumberger Oil Service Company for several years, where he worked and developed the interest for private sector involvement in rural healthcare service delivery and in the Niger Delta region. He was the immediate past chairman of the technical committee of the Forum of CEOs of state-supported health insurance agencies in Nigeria, and was recently made a member of the World Bank-led Country Connector on Private Sector in Health Steering Committee. Thank you, Dr. Ben Nkechika. It's good to have you. Good morning. Board here.
Yeah, good morning. Thank you very much.
Thank you. Next on our panel is Dr. Amina Mohamed Baloni. Dr. Amina has over 25 years of practice as a clinician and a public health professional. Her core competence of communication, drive for results, and working with people was honed during her years in developmental work, which has helped her achieve results while working with governments in various states to improve the health and well-being of children and women by building capacity and transferring technical skills such as planning, analytics, formulation of strategies, and monitoring for results. A foremost professional with broad public health knowledge, working to impact health systems as a vehicle to provide sustainable development and results. She's a team player who leads by building consensus among her team and is passionate about developing people. She's also a good listener. She believes that strong systems provide sustainable development and results. She was the immediate past Commissioner of Health in Kaduna State, and under her leadership, the state was recognized as one of the best states in management of COVID-19 pandemic response, as well as the pioneer states that entered a partnership with Zipline to deliver medical consumables, blood and blood products to hard to reach, far to reach, and security compromised communities. Thank you very much, Dr. Amina. It's good to have you. Thanks for joining in this morning.
Morning, everyone. Thank you for inviting me.
So I'll move over to Dr. Pamela. Let's delve into this conversation proper. Healthcare Federation is renowned and known for your extensive work with the private sector. So just like I know a lot of listeners will be interested, they want to know more about Healthcare Federation and how you work with the government, you work with the private sector, and in addition, you can highlight ways that the private sector can strengthen maternal health care. What opportunities exist for the private sector engagements, especially in the health sector in Nigeria? Over to you.
Thank you. Thank you very much for your kind invitation. The Healthcare Federation of Nigeria is the umbrella body for the private sector in Nigeria. And we represent all aspects of healthcare, and our focus is to advocate to the government for better policies and improved health outcomes. Now, we've done a lot of work, working in collaboration with the government. I mean, we've been active for 8 years now, and there have been a lot of what I call successes and a lot of work still in the pipeline. Some of the things that we have worked on include things like the Cancer Health Fund. We were extremely active during COVID and were really at the forefront in pushing for private sector involvement, which resulted in the testing and the management, improved management that was seen. Our members are key operators in several of the systems, and I'm sure that Dr. Ben will also be mentioning the fact that some of our healthcare, the HFN members were also part of the Delta State, involved in the Delta State scheme, as well as working with Lagos State as well. We have been involved in several policies. We are active in pushing for the improvement of several aspects of the private sector, private-public integration, which is far better than public-private partnership. And we know that there's a lot of progress that can be made when the public and the private systems come together to work seamlessly for, as we say, it's one public we work for, and we need to work together seamlessly to deliver that service. Now, there are a lot of opportunities in maternal health and in healthcare in general for the private sector to play a role. The maternal health is largely covered by the public health systems, but private healthcare takes care of over 60%. In fact, in some states, over 75% of the healthcare systems are operated in the by private facilities. And when you look at maternal health is supposed to be a time of joy. Being pregnant is supposed to be a time of joy, looking forward to new life, not a time of fear and anxiety as to the outcomes, which is what we have currently with our current indices. And of course, the private sector has a crucial role to play in this, in improving these health outcomes. And we are very keen, and we are also currently even working with the new government to work on ways to accelerate progress on this. Now, what can be done? I think if we look at it simply, we can say collaboration with government is key, and we are very keen to work with government. And as you know, there is a need to invest in our health systems, but there needs to be an alignment. There needs to be an opportunity. There need to be incentives for the private healthcare to actually invest. And the HFN have actually worked with the government and have produced a draft national policy for incentives, or for incentivizing healthcare delivery, which just simply actually needs to be signed into law for us to kickstart a lot of progress in this area. Additionally, I think one of the things that I know Ben will be talking about, but a key area would be concessioning facilities. There's so many facilities that exist that need help. So we don't need to start from ground zero, as it were, but actually work with the government, taking over some of these facilities and with the right incentives, create, the kind of enabling environment that can deliver the kind of quality care that is needed. But as we've all, as we mentioned before, someone needs to pay for these services. And these services, health insurance, it's a key area. The implementation of our the Health Insurance Act, the authority that came into force last year, is key. And if necessary, I believe there may be a need to actually carve out a maternal health fund. We already have the basic health provision fund, but if it is necessary, we need to focus on and carve out a health fund or create a health bank to ensure that there's payment available for these. And of course, we're not talking about excessive payments. We need to make healthcare more affordable, because sometimes they say, oh, private healthcare is expensive. Well, why is it expensive? Because majority, over 95, 99% of things are actually imported, and the cost of importation needs to be reduced. We are also at the HFN talking to the Ministry of Finance to find out ways of implementing some of the policies, some of them already in existence, and implementing other policies to make sure that the cost of importation is brought down. But most importantly is the need to enable manufacturing in our country. Because if we look at other countries, places like India that have cheap healthcare, their baseline is the fact that they actually manufacture a lot of the things that they need to use for their healthcare systems. And so we can't get away from the fact that we need the government to put in place things like electricity. We need to put in place, the basic infrastructure that we need to enable manufacturing. And we need to look at things like financing, creating financing systems to ensure that we can deliver on these. And we mustn't get away from the fact, or I'd like to include the fact that there are a number of new technologies that are coming into force. And some of these can be used in improving maternal health. There are, in fact, already some young companies like Baby Me Go, Pregify, and so on, that are already reaching out using apps and using the internet. And there's a lot that can be done to improve maternal health outcomes using telemedicine and other platforms with the wearables and creating virtual wards and virtual support for women, and including remote consultations and monitoring for pregnant women in rural and underserved areas. So there's a lot that the private sector can do in also training and development. I don't want to spend the whole session talking about this, but there's a lot that can be done, and there's a lot of opportunity for the private sector in this role. But we just need to make sure that we work with the government and ensure that obviously regulation, quality and standards are maintained as we deliver the efficiency and improve technologies and investment that is required. Thank you.
Thank you. The opportunities abound. It's all about identification of these opportunities and also financing, which is key for the private sector. So opportunities in manufacturing, medicine supply, logistics, and the actual delivery of quality services. And we require the enabling environment, which is where we're calling upon the policymakers and the government to be involved and push this agenda for enabling environment policies that will foster private sector collaboration. I'll move over to Dr. Ben Nkechika. I'm really eager and interested, and I know, like other participants, to hear about the Delta State Contributory Health Scheme that has been reported to enroll over 1.2 million beneficiaries and accredited over 500 facilities. Please share with us practical steps on how this was achieved. Thank you.
Good morning, and thank you very much. I will start by saying our current enrollment figure is over 1.4 million now, and accredited facilities are about 511. Talking about building resilient healthcare systems through private sector integration, I think it's important that we define what we mean by a resilient health system, because usually once you don't have a clear definition of what you want to achieve, then it's difficult to set the mark and be sure that you've achieved what you've decided to set up. For us, we looked at a resilient healthcare system as a system in which the patient gets the healthcare they need, when they need it, that is sustainable, and not with associated financial and logistics consequences. So I gave a very descriptive way of that. If a village man, a farmer, has waist pain, and he's able to get to a healthcare facility less than 30 minutes from where he is, at the gate, the security man welcomes him and directs him to where the medical record sits. He goes there within a short time, he sees the medical records person, he's directed where the consulting room is. He goes there, he sees the doctor or the nurse, they attend to him. He goes to the lab, he goes to the pharmacy, he picks his drugs, he gets an advice on how to prevent the waist pain. And when he's leaving, the security man tells him, "Oh, thank you for coming, hope we'll see you again," and there's a follow-up. That for me is the resilient healthcare system, as simple and as basic as it is. But the critical issue here is government able to provide this resilient healthcare system across board, considering the current physical challenges, the administrative and the bureaucratic bottlenecks associated with healthcare service delivery? And the answer is no. Okay? COVID showed us that a collaboration with the private sector is the best effective way to achieve better health outcomes. So that was a concept in which we decided to follow up the Delta State Contributory Health Scheme. When we started, we spent quite a lot of time determining the models to implement and the scale in which we're going to implement them to ensure that we achieve the outcome within the stipulated timeline. And situating it to when we're looking at maternal care or the private sector involvement, we used the model of, first of all, we had a baseline assessment to determine the status of the healthcare service delivery in Delta State. And we also determine the capacity to deliver the healthcare system if we decide this is what we want to achieve. So we try not to be too elaborate on the startup processes because it was quite long and quite difficult. But it got to a point where it was clear that for us to achieve the critical mass we just could not depend on only government hospitals. So we decided to go for the private hospitals, but we realized that there were these areas that there were infrastructure built up and the hospitals were just locked up. A typical example is Kolobubo and Oporoza that had facilities built 25 years ago and it was just locked up. And all we did was clear the bush, opened it, and the equipments were still there. We got them fixed, we got the biomedical engineer fixed, and they started receiving care. The beauty of it is that these people had no alternative access to care. And it was quite a difficult situation. And we're able to achieve this because of an effective collaboration with the private sector. And to do that, I'm going to list out some positive factors, and I will use the Delta State model as an example. The first is a political will for the private sector and government to integrate for better health outcome. You must get the political will, because the political will that gives you the turbo to charge it. And we're lucky in Delta State to have a governor who was quite understanding, his medical doctor. And as soon as we approached him and said, we have this challenge, we want to go this way, he gave us the go ahead. And that gave us the strong political will from the government side. And the next question was, there's going to need to finance it, because you can't just expect government to partner and finance it. The private sector needs to be guaranteed that they are going to get paid. So we approached Pharmacists Foundation, and we're able to develop a clear framework with an implementation plan. And that was quite robust. We had a meeting with the Bank of Industry, and they agreed to partner with us. And because we are not financial experts, so we needed that support system. And we're able to build this clear-cut relationship. And then that enabled us to have the trust and the openness to be able to work with the private sector and build that trust that will help them feel that they are part of the system. And we determined the stakeholder, and we're able to get all the stakeholders involved, the local government chairman, because they actually own the building. We got the community people involved because they understand what they need. We have meetings with Okada riders, market women. Everybody told us this is the kind of healthcare system they need. And we're able to develop a benefit package that met that requirement to a very significant extent. So in that way, we got all stakeholders buy-in. And then through the framework, we're able to create a transparent system in which we advertised private sector and the organizations putting their expression of interest. We're able to evaluate it in partnership with Pharmacists Foundation, and we engaged them. And the clear thing was that we also needed to ensure that it was not a financial burden to the private sector. So Bank of Industry gave us that opportunity. But like I said, there were bottlenecks, and we all agreed that whatever bottleneck we would meet in the course of the program, we must find a way. I give a typical example. When we concluded and we're going to engage the private sector, the Bank of Industry said we're going to do a credit check on them. And majority of them needed to bring in collaterals and all that. And we said, no, the focus should be health outcome. And the outcome should be the satisfaction of the patient. So putting the private sector through a rigorous financial evaluation body will slow down the process. And is it possible to mute the other mic? I'm hearing some interference, please. Yeah, and we're able to achieve that. We had to write a letter to Bank of Industry, giving a full 100% guarantee to the private sector operators that give them the loan because it was a commingled fund, and we will bear the full responsibility. But we're able to do that because we have also built up a resilience monitoring and evaluation system fully dependent on ICT, where we're sure that if we receive a bill from a facility and it complies with our procedures, we will definitely pay. We ensure that we have the funds reserved to be able to make prompt payment if all the claims issues are cleared up and are resolved. So in a nutshell, trust, openness, political will, a clear framework, stakeholder engagement, ensuring everybody is a part of the process from the first step to the last step, and then also having the notion that in the course of it, there are going to be challenges, we're going to be able to overcome them, and we're going to be able to ensure that what matters is the fact that the patient gets the best outcome, and that should be the principal focus. For us, we are looking at how to continue to expand. We're improving the collaborations and getting more stakeholders into the system. In fact, I'm actually in Port Harcourt. I'm having a meeting with NDDC. We discovered that they have over 400 facilities built all across the Niger Delta region. 80 to 90% of them locked up, and negotiating with them that this model can be used to get those facilities operational. And those are the kind of things we should be able to do. And I'm happy that the Country Connector program is on. It's going to be quite effective to be able to get these models across, using the best practice models across the world to see how we can domesticate outcomes through interaction. But there's something I will use as a closing note, which is the fact that I try to understand why are there always challenges when there's a private sector government interaction. And I realized it was just a case of what I will call a participatory collaboration. Because when we just say collaborate and one person is outside of the house and another person is inside and they're talking to each other across the fence, it doesn't work. So I've looked at it that a participatory collaboration is always important. The private sector should be able to be inside government to understand how government thinks, and the government should be able to interact with the private sector to see how it thinks. And that was why the fact that all my life I was a private sector person, I decided to take a step and go into government and see it from the government perspective. And I was quite surprised that it was just a case of each person looking at a bottle, whether it's half full or half empty. But when we all decide that so long as there's a content to the bottle, we'll use whatever the content is to achieve health outcomes, that brings a convergence, and that's what we're able to do. Thank you.
Thank you, Dr. Ben. I was going to come to the next question, which talks about the challenges that you have encountered in collaborating with in this private-public partnership. But you've gone a step ahead to share some of these challenges and even why. Thank you so much. I'll move on to Dr. Amina. Dr. Amina, you share with us lessons from public-private partnerships in building health systems, and also, very importantly, because we know one challenge that government faces and is always pointing out in this public-private partnership is coordination. How best can government ensure quality standards and strengthen governance while integrating the private sector in healthcare provision? And also, how best can coordination be achieved as a whole? Thank you.
Thank you very much, and thank you for inviting me to this webinar for this very important topic. Let me just state a little bit of the context we have in Kaduna State. Being one of the states that has one of the highest maternal mortality rates, infant mortality rate is not so high, but it is still above the national average. And a society where you have maybe about 60, 70% or 80% of the people living in rural areas, not in the urban areas. And the traditional practices of patriarchy, which prevent women really from accessing care, and the resistance to the change of women having deliveries in the facilities. So with that background, I think, and with government being the biggest player in health sector, really, I know the statistics are that people access private care. But private care, what type of private care? The majority of private care that the rural people access, or the people that are accessing care, are actually PPMVs, chemists, medicine shops, very often manned by people that are not healthcare professionals. Kaduna State has over 1,000 PHCs. And so one of the first things the government did was to try and revitalize that system and put in health education and a collaboration with the traditional leaders to make sure that we change the narrative and improve health-seeking behavior. But in trying to involve the public sector, the private sector, I think Kaduna State looked at it from the point of view of what do we want to engage the private sector to do? Is it in the supply chain? Is it in service delivery? Is it in regulation? And one of the first things that we did was to elaborate a PPP for health policy, which looked at what is the public-private partnership framework in the state, what are the health peculiarities and challenges, and looked at the national framework to develop one that is peculiar to the state. And the partnerships we entered, or as my colleague Dr. Ben said, it's better to say integration. Sorry, Dr. Pamela said it's better to say integration rather than partnership. You have to have a framework, first of all. You have to understand what you require. One of the things we found in our public facilities is that we had stock out of commodities, of essential medicines, of drugs to help provide services. And so one of the first things we did was through ARC ESM, we engaged the private sector, the pharmaceutical sector that manufacture in Nigeria. And as was pointed out, you can't be importing things and expect you won't have stockouts. Fiscal constraints are there, supply chain issues are there. So we entered into an agreement with the PMG-MAN, which is the Private Manufacturers Association, Pharmaceutical Association, to provide essential drugs and commodities to be able to get our supply chain working. And we jumped from about 40% to about 80% availability in facilities. And then, of course, what was mentioned in my profile, we had a lot of far to reach communities. We have over 6,000 so far that we've mapped. And with the security challenges we had in Kaduna State, it was very difficult to get to those commodities to those areas. And we had women dying of maternal causes. So we also engaged in a partnership or an MOU with Zipline, which is the foremost drone delivery company that delivers medicines, drugs, emergency medicines, especially blood and blood products, which is one of the commonest causes of death. Maternal death is hemorrhage, and there is no blood or blood products to do that. So we entered into a partnership, and although we have one center, we aim to cover the whole state. Within 6 months, we had done more than 10,000 deliveries as at requested, and that helped a lot in service delivery. The question you asked me was about coordination. That's very important. It's one of the things that we don't, as a nation, do very well. We have a lot of partners, we have a lot of support, but the coordination to stop duplication, to make sure all areas are covered, to make sure that the donors or the partners we have address state or community priorities has not been very good. So what we've tried to do in the health sector is to strengthen our partnership, our coordination platforms. So we have a coordination platform that covers all the agencies, all the donors, all the partners, which we ensure that the planning we do looks at our state priorities and hold everyone, government included, accountable to delivering those services in a way and manner that doesn't duplicate resources or creates wastages and parallel systems. So that's one of the things that we've tried to do. It's still a work in progress. We have a lot of resistance, and we've included also that the private sector, we have a separate coordination platform actually with the private service providers. But as I said, a lot of them are unorganized private sector. We have we mapped about 3,000 facilities that provide, private facilities that provide some sort of medical care. And over about 2,000, coming up to 2,000 plus, are actually on, their patent medicine stores or vendors or people just opening up shops. So you don't expect any quality service from those places. So we try to engage them for the need, first of all, that we must have regulation. We must have standards. And recently we passed a new law on establishments, private health establishments. And we broadened that to include government regulation of also government facilities, so that it doesn't look like we're targeting just the private sector. And also we have to have the same standards. As Pamela mentioned, we're serving the same public. We have to give quality standards. So for us, the focus was more around the enabling environment, getting the private sector to support service delivery in supply chain. We're in talks with LifeBank to see how we can do distribution better, in addition to Zipline. As you know, Zipline deliver in drones, and these are small structures that carry about 2 kg. So what Zipline does for us is it provides instantaneous commodities, drugs that are needed, while we use the larger fleet to do the supply chain. But we also have to look at what the quality of in engaging with the private sector. And it's very good. Lagos has a developed private sector, probably Delta has, Abuja. But when you come into other states, you find that the private sector players that want to be involved are not as organized as you have in those other places I mentioned. And you don't have outfits like Duchess, or even outfits that not are at Duchess standard, but or size, but provide excellent quality care. But for our states, we have really, most of the people are also struggling, and one of the challenges is that there's some distrust between the public sector and the private sector. And although we tried to harness this during COVID-19, when we had an existential emergency, nobody knew what was happening. We still had some pushback. I think the general feeling is that maybe government wants to shut us, or they want us to pay more taxes. But we've been working, we now have a full-fledged committee that works to work out these issues. They support the state government in going around to regulate, making sure that people that are providing services have licenses, first of all, and are adhering to standards. And we hope that this collaboration will continue. No doubt, the government alone cannot provide all services. But when you're engaging the private sector, you also have to be sure that you have the same goals. A lot of them are private for profit, and some of them are resistant to, saying that, you regulate prices, or you make sure that they don't exploit. But one of the ways also you can explore that is if we get a very strong health insurance coverage and health insurance system. And Dr. Ben talked about that, how they were able to do it. We're not too far behind you, Dr. Ben. We're around 800,000. But the challenge we have actually is enrolling private individuals onto health insurance. There's still a lot of distrust around health insurance, and we have to work around that. Once we can get the financing sorted out, and I saw that as one of the questions, public funds, taxes, SIM taxes, if you like, health insurance, and you get the coverage high enough, you will be able to fund healthcare. But you must have strong regulations, strong quality standards, and a strong framework that holds both public and private health providers accountable for service delivery in in our states. Thank you.
Thank you very much. One salient point that is coming out of every discussion is we cannot discuss private sector integration without health financing. Earlier in the year, in the month of May, we also had a policy dialogue organized by Nigeria Health Board where we extensively discussed the provisions of the NHI Act. And I think greater awareness should be provided also to the general public to continue to disseminate the provisions of this act so that the general public can access the provisions as we keep pushing for effective private sector integration. Like we have established, COVID exposed the fragile health system, and that government, the public sector, cannot do this alone. We're running with time, and we have a teeming set of questions, but we will not be able to take all due to time constraints. However, I will just request that as guests type their questions, please notify or indicate who the question is directed to. I'll take this first two, and the first one I'll direct to Dr. Ben Gechika. It's from Isa to Sa. He's asking, how can we create smart investment vehicles that unlock public and private investments in healthcare delivery where they are most needed, such as in primary healthcare? And this second one, we want Dr. Amina to attend to it. It's coming from Grace Oluwatoye. Considering the role of TBAs and mission midwives who work at the grassroots and rural areas as informal health service providers, how are you planning to capture this critical group to reduce the challenges associated with service provision? So in the next few minutes, I think 1 minute each, please, so we keep to time. Kindly attend to the questions. Dr. Ben. I'm trying to see if he's still on the call. Oh, apologies, I think he has a dropped call. So we'll move to Dr. Amina. The participant is asking, how can the role of the TBAs, midwives in the rural areas who are providing these healthcare services be captured and catered for in this whole integration and the challenges surrounding the service provision mitigated as they provide services in these hard to reach areas?
Thank you. Thank you for the question. First of all, let me just say that studies have shown that TBAs are not really making an impact in reducing maternal mortality, mainly because the conditions that we know that lead to mortality, deaths, and severe morbidity, like hemorrhage, like sepsis, cannot be, solved by the TBAs. And so I think the consensus is that TBAs should no longer be service providers, but more enablers. So for example, what we have is we've engaged our TBAs, we've trained them to recognize the danger signs. We've trained them to sort of be companions to the pregnant women in the rural areas. So they check up on them, and we link them to the PHCs. As I said, we have over 1,000 PHCs, and each of our 255 wards has a fully functional PHC. So what we do is the TBAs in the communities, we link them up with a health educator, with the maternal health coordinator, to make sure that they map the pregnant women They ask them the questions. Are you bleeding? How do you feel? They try to, get a sense of whether the pregnancy is complicated, and incorporated them in the chips so that they now report to the PHC and link them to the PHC so that they are able to receive the services at the PHC system. We've tried to we've employed midwives for each of our 255 additional midwives. We didn't have, not all the facilities had them. And we've also done training for the senior Jews, modified life-saving skills for them to be able to, get supervised deliveries. We're working on the referral system. We have about 30 secondary facilities across the state, and we've linked them through ambulances to be able to pick in the LGA. So we have a secondary facility, one or two, some of them have two, the bigger LGAs, and they have an ambulance, and we've linked them to the ward development committees to say, if you have a woman that is in distress and you can't pick her up, please, call the ambulance and let them do that. We also have the Road Transport Workers Association, which we have an MOU with to also transport. So what we've tried to do with them, and the challenge is that because some of the midwives are used to taking deliveries and there's a monetary compensation to it, they still do that and they still hold on to patients when they should have sent them forward to get care. So we're still working to make sure that they're integrated, and we give them some sort of token that will help them mitigate that monetary loss instead of taking the deliveries at home and getting complications. So it's as you know, changing behavior is difficult. It's coming along, it's getting better. In some places, it's not so good, but at least we've engaged them. But just so that even the NGOs that are working with TBAs, we've had to engage them and say, look, TBAs are not service providers. Please don't give them the false sense that they can do these things. If a woman starts bleeding, no TBA is going to be able to solve that. Thank you.
Thank you very much, Dr. Amina. And I believe, Grace, your question has been attended to. The role of TBAs basically across the state should be for them to, their capacity to be built, to be able to identify danger signs and promptly link and refer to a skilled birth attendant in the facility that will take care of maternal service delivery. Because with MSD for Mothers, MSD for Mothers has an overarching goal of a world where no woman has to die while giving life. Okay, Dr. Ben, there was a question for you. I hope you're back on the call, and I'll go to the question at once. How can we create smart investment vehicles that unlock public and private investments in healthcare delivery where they are most needed, such as in the primary healthcare? Dr. Ben, please.
I'm not hearing you very well. I didn't hear the full question, please.
Okay, the question says that how can we create smart investment vehicles that unlock public and private investments in healthcare delivery where they are most needed, especially in the primary healthcare?
The first issue is to identify where these investment opportunities are, and then you determine the best approach to integration, and they are both aligned, because there's always that disconnect. There are lots of investment opportunities all over. Like I keep saying, I'm currently at NDDC, and they have a huge resource for healthcare, particularly primary healthcare. But if you don't engage them and direct them towards what is expected or what you think is most important, and it relates to what they are going to do, they'll probably put the investment in other places. Like I give an instance, I heard they were planning to bring in a mobile hospital that's going to sail from one community to the other, which looks like it was fine. But the question is, at low tide, high tide, will those vessels get to where those communities are? The answer is no. Will the people be able to come there? The answer is no. And meanwhile, they have these hospitals built and locked up. So I just said, use the health insurance model, use the access to finance model, put these resources and get those things operational, get the facilities you have built operational instead of building new ones. So unlocking investment through private sector and collaboration has to start with proper understanding, identification, collaborative responsibility, ensuring that there's a good framework, and then creating, it's important to start looking at healthcare as a business and not just a service. When you look at it as a business, then you prepare your proposals, you prepare your plan as a business model. Every business model must have a return on investment. Some business model, the return on investment is that you're going to make this millions of dollars or naira. But in a healthcare, the return on investment should be how many lives are you able to save? How many people are you able to give access? How do you ensure no woman dies while giving birth? How do you ensure that every child has the proper nutrition, the proper healthcare and all that? That should be quantified as the return on investment, and the opportunities will be unlocked, creating that model and relating in that way. Thank you.
Thank you. Very critical. Return on investment in healthcare should be quantified by how many lives have you been able to save. We're running out of time, so I would just go to Dr. Pamela for her concluding thoughts. What are your recommendations in terms of policies that will foster private sector integration? So we'll just do that in 1 minute, please. And
lock up. Oh, no.
Thank you
lock up, then go back. Okay.
very much for this opportunity. I think a lot has been said, a lot has been brought to the table. If I could just pull out some of the things that both Dr. Baloni and Dr. Nkechika actually brought out. The first thing is creating a framework. What's the public-private partnership or integration framework that is created? There are certain public-private partnerships that are currently in government, but they are for bridges, they are for, they are for building roads. Healthcare is specific. We need specific ones, and we need to make sure that these frameworks are balanced and have the interests of both parties aligned, is what I would say, and ensure that there's trust. A strong word that was brought out by Dr. Ben was trust. There needs to be trust on both sides. And how can this happen? These frameworks need to be built together. There needs to be a platform, and I think Dr. Baloni mentioned it, where the private sector is brought in, where organizations like HFN are brought to the table, not just individuals who are looking at one aspect or another, but umbrella bodies that look at the private sector and can work with the different organizations or the government to create this framework. I think that's number one, is creating the framework. Number two is regulatory reforms, enabling and updating and reviewing existing regulations. Creating the issue of payment cannot be overlooked. So ensuring there are investment incentives, as I said before, the draft policy, the national policy for incentivizing healthcare, that needs to be brought in and that needs to be signed. And there also needs to be certain aspects in terms of building, capacity building, and ensuring quality assurance and accreditation. And this should not just be in one aspect or another, but globally looked at across board. I'm very happy to hear from Dr. Baloni that it's not just the private sector that will be regulated, but also the public sector. So there's uniform quality assurance across boards. The issue of defining clear roles and responsibilities is key, ensuring there's proper data sharing and collaboration, and also the importance of research and development, research and ensuring that we have proper understanding of our own Nigerian specific issues. And so we are able to create solutions for our own specific problems. And of course, ensuring that we can monitor and evaluate the collaborative efforts that are put in place. But in particular, as we discussed earlier, the issues of making sure that healthcare is affordable by ensuring that the policies that effectively reduce cost, particularly with the in Ministry of Finance, need to also be addressed. Thank you very much.
Thank you very much. We'll take a few more questions from our guests as we gradually wind down this session. We're in the question and answer session proper. We have a question from a participant. Okay, I think we missed that. On this note, esteemed panelists and participants on this webinar call, we would say thank you for joining these conversations. Bumi will be coming up next to share call to actions, next steps from these conversations. Thank you, Dr. Pamela Ajayi, President, Healthcare Federation of Nigeria. Thank you, Dr. Ben Nkechika, Director General, CEO of Delta State Contributory Health Commission. And thank you, Dr. Amina Balole, former Kaduna State Commissioner for Health, for the extensive and insightful discussions. Thank you. Bumi, over.
Thank you very much, Kachi. I hope everyone can hear me. And so thank you to all our guests, all the delegates that were able to join. Many thanks to our speakers, the presenters, and also the panelists. Kachi has also gone ahead to, give her vote of thanks, and I wouldn't repeat that. So very quickly, because we are out of time, I'll just go through the key, some of the key, messages and action points from our speakers, our presenters, and our panelists. So, starting from Dr. David Clark, thank you for, bringing to light the work of the WHO Country Connector and, how it's evolving from, supporting countries through their COVID-19 recovery, supporting them, going from doing that to actually supporting countries in terms of capacity building and, putting together or trying to fill in the gap for the capacity of country governments, and in this case, Nigeria, to actually create an ecosystem whereby, public and private sector can, come together and, create a viable health system for maternal health care in Nigeria. And talking about capacity building, they are now, talking about the Country Connectors plan to be more action focused. And then from there, we moved straight into the panel discussion. Apologies because of time, I wouldn't go through, Vivian's remarks and also Timitayo's opening remarks. So we started with Dr. Pamela Ajayi, who, kind of started or opened the conversation, reminding us that maternal health care is actually catered to 60 to 70% of maternal health care in Nigeria is actually catered to by the private sector, whether the organized private sector or just like we've identified the unorganized private sector. And there is the need to actually create incentives for these private sector players to invest in healthcare. So obviously this is the organized private sector, the financiers, and creating incentives for them to invest in maternal health care in Nigeria. And another area, is also working with government to improve existing health facilities. So I like that not just Dr. Pamela Ajayi, but also Dr. Ben also highlighted this. We have healthcare facilities all over. Many are dilapidated, many are not functional, many are just, hanging by a thread. What are we doing to actually revive these healthcare facilities? And she also spoke about, there are also solutions, the obvious ones being, investing in their infrastructure, where if you're talking about electricity, water, water infrastructure, and also a need for, additionally, this was also spoken to by Dr. Amina Baloni, a need for investments, for more strategic investments in the private health and in the health sector. And this would be, further accelerated by the private health sector. And then she also spoke to, creating virtual support for women through technology. That's one of the solutions that we have been exploring. And I know MSD for Mothers works with particular initiatives and programs in Nigeria, particularly MDOC, working to provide healthcare, maternal healthcare through technology, and taking advantage or utilizing these platforms and virtual care to actually support women in the continuum of care. And then we went on to Dr. Ben Nkechika, our government side, talking about the success factors for public-private partnerships and public-private integration. I think the standout from his conversation was, highlighting the need to focus more on integration rather than, mere partnership. So yeah, we're going to speak to partnership, to collaboration, but there's also a need for the public sector and the private sector to actually integrate to provide, better quality care and better care that is has quality assurance attached to it, quality improvements, and also standardization. And his success factors for this integration, political will. Without political will, I don't think we can, go far. And also financing. All the speakers, including the presenters and the opening remark given by Timothy spoke to the role of private sector in actually improving health financing for the maternal health care sector, and also stakeholder collaboration and integration right from community level to the health facility level to the government level. And again, he also highlighted, the needs to, there's no need to start from ground zero when you're talking about private healthcare or other health facilities. So these health facilities exist. We just need to invest in them and make sure that they are able to provide the quality of care that is needed to help women. And Dr. Amina Baloni spoke to the private sector. She started with talking about the unregulated private sector and how it's dominated by chemists, in quotes. And Dr. Amina Baloni, you mentioned that these chemists are unregulated and they cannot even provide care. I'll just quickly highlight the Integrity project. The Integrity project, which is spearheaded by Society for Family Health. They're working with the Pharmacist Council of Nigeria to, improve the capacities of these PPMVs in local communities, because they are the only ones these local communities have, and they are there to provide care, provide, family planning services, contraceptives to these local communities. So if we actually train them, which you highlighted, they'll be able to provide quality services. So they are not all bad. They don't all provide poor quality services. So this is part of the conversation of today. If we are actually able to provide, capacity building for these private sector players and providers, they're going to be able to work with the public sector, with the government, to provide better quality of care so that women have better health outcomes. And we must also have, the regulations and standards, obviously, to guide the work of the private sector. And health insurance. So not just Dr. Amina Baloni, all three speakers spoke to the crucial role, the critical role of health insurance, and should I say, a deviation away from paying out of pocket for maternity health care, for maternal health care. This is quite critical, and the private sector needs to work with the government to ensure that the teeming number of private individuals are, lifted out from, being out of the health insurance system to actually finding a suitable plan or a suitable platform for them to be able to afford care and not have to rely on out-of-pocket services. And then we closed off with Dr. Pamela Ajayi's, closing remarks, which were quite insightful. She just put everything together, luckily for us, reviewing existing reforms. We should not just like, I know my boss, Vivian, always alludes to this. We have these beautiful plans, these beautiful policies, but, we have to review these plans and actually put them into action. We actually need to implement them. So reviewing the existing policies, existing reforms to actually make sure that they are of benefit to the maternity healthcare system, and they actually support, better quality and better health outcomes. And also incentivizing healthcare, quality assurance and accreditation, research and development in the Nigerian context to make sure that we actually are providing solutions that are relevant for Nigerians and not just, cookie cutter solutions. And then finally, collaborative efforts of the different stakeholders, which was also highlighted by Dr. Ben. And I think that would bring us to the end of this, and we can move on to the next. Over. Thank you very much.
Thank you, Bumi, for the call to actions. Next steps. This will be put together in a document, in a communique shared to the participants. We have your email addresses. I hope you correctly put them in so that we can continue to engage with you. And also, this will also form points for discussions in engaging with policymakers and government on private sector integration for maternal healthcare systems. Last on my agenda is the closing remark, and I'll be inviting my MD, Vivian Yekwazu, Managing Director of Nigeria Health Watch, for the closing remarks. Thank you, Vivian.
Thank you very much, Kachi, for moderating this event. And thank you all who have joined us so far. I'll keep this extremely brief so that I can give you back the rest of your day. I hope that the knowledge and expertise that we've shared today will really inspire new ideas. I'm sure many of you would have engaged with organizations that are working with the private sector or already in the private sector. And I think a lot of these innovative approaches and strategies are one that are pertinent, especially as we look to improve outcomes in our health sector, because really nobody can do it alone. No sector can do this alone in addressing a lot of the maternal healthcare challenges that we encounter in Nigeria. And it really requires multi-sectoral efforts, but also let's not forget addressing some of the prevailing underlying issues, gender equality, socioeconomic development that lead to these poor maternal health outcomes. As Kachi said, some of the outputs from this webinar will be, we'll share the link after this event. And we'll also be putting together a brief report summarizing a lot of the discussions we've had. And this conversation will continue because as David mentioned, there's a lot of information that can be shared, and there's still a lot to learn in how we can ensure that there are these stronger partnerships between the public and the private sector, all centered around delivering better healthcare for women. That is actually quality healthcare, not just delivering healthcare and making it available, but access and quality has to be central to all of this. I'd like to thank MSD for Mothers for their support in making this event possible. I know MSD, as you've heard many times, is a global initiative that's looking to create a world where no woman dies giving life. But this mission is exactly the same for every single one of us on this call. We all want to create a world where no woman has to die giving life, because it's something that's personal to each and every one of us. Because we, as a mother, myself, as a sister, as an aunt, as one day a grandmother, we all think this issue is personal to every single one of us. And the poor outcomes in Nigeria does not leave much to be desired. And we do know that collectively we can do much better, and we should do much better for our mothers. Thank you again, everybody who has joined today. Thank you very much for our speakers, David from the Country Connector, for enlightening us on the work about the Country Connector, and especially thank you for I know it's very early for you in Washington. Thank you also to Dr. Ben, who again also is up very early joining us. Thank you so much for taking this time to join us this morning. And thank you to Dr. Amina Baloni, as always, former Commissioner for Kaduna State. We look forward to continued engagements with you. And of course, Dr. Pamela Ajayi, the President of the Healthcare Federation of Nigeria. I think it's an organization that's extremely important in highlighting the important role, pushing for policy, advocacy, implementation, working with the different ministries to ensure that the private sector is working hand in hand with the public sector. So thank you all very much. I will give you back your morning. Thank you very much for joining us this morning. And we look forward to continued and future engagements with you through our organization. And of course, thank you very much to the Nigerian Health Watch team for working hard and putting this event together. And we look forward to continued engagements with each and every one of you. Thank you and over. Have a good day. It's almost afternoon. Bye.
On that note, thank you very much, Vivian. I would say it's goodbye from me. Do enjoy the rest of your day as we continue these conversations on private sector integration. My name is Onyedikachi Ewe, the Senior Program and Advocacy Manager for Nigeria Health Watch. Thank you for joining us this morning and do have a great day ahead of you. Goodbye.